Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Network Strategist with the NASHUA Division of Public Health and Community Services. Before we get started with our special guest today, I'd like to give you all a COVID update. We have high transmission across the United States. Omicron is accounting for over 99% of the sequenced cases across the United States. The majority of hospitalizations for COVID-19 are in those that are not vaccinated. While breakthrough cases are being reported, many of those cases are mild. And when we talk about a breakthrough case, that's if you've been fully vaccinated and boosted. Our next slide talks about the variants of concern. Right now you can see on the left, we have a slide that has all gold. By the time we get to January 22nd, on the right, Omicron, which is in purple, has completely taken over the cases in the United States. And we know that this happened very quickly because we have found that Omicron is much more transmissible and takes less time to spread. Looking at a United States map, we have a 7-day average of 1,258 per 100,000 cases per day. We have a 23.88 positivity rate across the United States. That's really high. We need to get that below 5%. And if you look at this map, we see that our friends in Kentucky and Tennessee are not faring well, and also some of those western states of Arizona, Utah, and California are also darkening up quite a bit, as well as Alaska. In New Hampshire, we have a total of 270,063 cases to date. Active cases, we have 14,524, and our test positivity rate is 16.1%, lower than the rest of the United States, but still concerningly high. We have 1,941 cases that were reported for January 27th, and our hospitalizations stand at 387. Many of those, that number has declined over the last week. And we've had 2,193 deaths in the state of New Hampshire due to COVID-19. And our sympathies go out to family and friends who have had to weather the experience of a death in the family. In Nashua, we have 921 active cases, and we have 2,625 active infections, over 100,000. Our test positivity rate in Nashua is 22.7%. Again, we'd like to get that number below 5%. In Greater Nashua, we have 2,046 cases. Fully vaccinated, we have 53.7% in Nashua, and in New Hampshire, we're at 56.1%. We need to do better. We need to get more people vaccinated. Just a reminder that booster doses are available for everyone 12 plus if you've completed your primary vaccination series. After 5 months, you can get a booster. They're recommended for all of the available COVID-19 vaccines in the United States, and you can choose what vaccine you want for your booster. If you're 12 to 17 years old, if you have a child who's 12 to 17 years old, they can only receive the Pfizer vaccine. That is the only one that has been approved for children at this point. So there's new terminology from the CDC. Are you up to date? Up to date means you've completed your primary vaccination series and you've had your booster dose. So please get up to date. We have a lot of options for vaccine right now. So the newest option is that the Vaccine Fix site is now open. This is on 34 Northwest Boulevard. It is really off of Amherst Street in the plaza where Market Basket is, right next to Marshall's. So it's in a plaza. It is open every day from 8 a.m. to 2 p.m. You do not need an appointment. And let's make these folks really, really busy, okay? So that we can get rid of this COVID-19 virus once and for all. Next, I want to remind you all to mask up. The Board of Aldermen did vote to extend the mask mandate, or ordinance as we would say, to the end of February. So we do ask that you wear your masks and continue to do so. Masking reduces transmission by more than 50%, and we really hope that Any mask that you wear is better than no mask, so please mask up, NASHUA. If you need vaccines, vaccines.gov, resources and guidance, vaccine appointments. And finally, if you have signs or symptoms of COVID-19 and if you've been exposed, there's free COVID testing available. 7 days a week, 9 a.m. to 3 p.m. at 25 Crown Street in Nashua. This is really important, folks, to get tested if you have signs and symptoms or have been exposed. If you've been exposed, wait till 5 days after your exposure and then get that test. And these are the PCR tests that are available. Ooh, and that's all I have for COVID. So I'm really happy to introduce my guest, Leah Elliot. Hello, Leah.
Hi, thank you, Jane, for having me.
Leah is our behavioral health specialist who recently joined the division.
Good.
And so we're just thrilled to have you here because we really needed to keep moving along on behavioral health, or mental health, as some people are more familiar with that term. So welcome, welcome. And where were you before you joined us at the division?
Well, thank you, Jane. So I have been working in social services for almost 20 years. I'm a licensed independent clinical social worker and a certified prevention specialist. So for the last 5 years, I was working at Nashua High School North and South. I was a student assistance program counselor. So we would work with any youth that were struggling with mental health or substance misuse issues and be able to recommend and refer them to services if necessary, and also provide some short-term and group counseling there at the school. I also work part-time currently and then at the Boys and Girls Club, where I'm a therapist there as well, and I oversee the clinical aspect of a program called Camp Mariposa, which is a camp for youth ages 8 to 18 who have been impacted by familial substance misuse in their family. So a lot of the youth that we have are in other placements with family members because they may not have a parent for some reason that is in their life. So I'm in charge of the clinical aspect of that. We have recreational and artistic activities that the kids participate in as well.
And that's a weekend camp?
Yes, so we have it's 1 weekend a month, and we alternate. So we have a youth camp, which is from ages 8 to 13, and then we have a teen camp, which is ages 13 to 18. So 1 month we'll have the youth camp, and then the following month we'll have the teen camp.
And do the same children return weekend after weekend, for those weekends, or do you have a different group?
Luckily, we have been very lucky to have most of the kids continue to return in the program. It's been going on for about 5 years now, and we are always welcome, new youth who are appropriate for the program. So, if anybody fits the criteria, they can definitely contact the Boys and Girls Club and ask about Camp Mariposa.
And so they must love it, like just getting that, looking forward to that every other month kind of reprieve and time away.
Absolutely, and they know that they're not alone. They're not the only ones that are going through what other youth at their age are going through as well. We have the 7 C's. They didn't cause it, can't control it, so it's nice to be able to see other people that are going through what they're going through and sharing those experiences. And it's preventative. So the hope is it's a prevention activity because obviously these are kids who may continue those patterns in their family, and because it's genetic, and obviously addiction is a disease, so there is that genetic component. So they're already at risk. So we're trying to provide some preventative services.
Well, so along that line, you mentioned that you're a certified prevention specialist.
Yes.
Tell us what that means.
I have the social work license, but prevention really focuses, again, on substance misuse and prevention and treatment services. I have been more in the prevention aspect of substance misuse. I was working with the SAG clubs at the high school, which stands for Destructive Decisions.
Okay.
And so it's really identifying positive ways to help youth cope with some of the stressors that they may be faced with. So every month there would be a theme, and the kids at the high school would work on an activity to raise awareness to that theme. So October is Red Ribbon Week, December is Mental Health Awareness Week, and so they would have an activity maybe in the gym or the cafeteria to help other kids get awareness to that, and then know what services were available. So February is Dating Violence Awareness Month, so we would have Amy Jo Muscat from Bridges come in and have a table and have resources available to the youth as well.
Right, busy.
Yes, absolutely.
Yeah, so good and bad busy, right?
Yep.
We wish you were less busy. So there's a lot you work on as a behavioral health specialist, excuse me. at the division, and some of the things that we talked about beforehand, the one thing is to decrease the stigma of mental health.
Absolutely.
Or mental health issues. So tell me a little bit about that.
Well, I'm very lucky to be part of a 3-person team in the behavioral health division. It's myself, Lisa Vasquez, who is the behavioral health strategist, and then we have Liana Perez, who is our nurse, and she's also working on the behavioral health aspect of what we're doing. And all 3 of us recently got trained with mental health first aid, which is a program that focuses both on being able to identify, assist somebody who is suffering from a mental health crisis. So I think being able to participate in that program, then being able to carry that out. And that program has a lot of discussion around reducing the stigma around mental illness and substance misuse. So for example, when somebody decides maybe to take their own life, we say commit suicide. But when you associate that word commit, it's usually with commit a murder or commit a crime. So it has a negative connotation to it. So we really want to raise awareness that somebody has died by suicide, you know, or ended their life by suicide, and it wouldn't be committed suicide because, again, it has a negative connotation to it. And we want to make sure that we're reducing that stigma and making sure that we're using first-person language and just raising awareness. The mental health first aid program is very similar to first aid, where a first aider would go to the scene if somebody was suffering from a medical crisis. And it doesn't necessarily mean that they're going to diagnose or be able to fix that problem long term, but they can identify what services are necessary in that moment. And it's the same thing with mental health first aid. So being able to, again, identify those signs and be able to refer somebody to those services. So if you think, you know, a lot of us know the signs of a heart attack, we might know the signs of a stroke, but are we familiar with the signs of somebody who's suffering from a mental health crisis? So being able to be aware of that as well.
So you set it up perfectly because you gave me a quote from NAMI, New Hampshire, from Kenneth Norton, who's the executive director, and he said, if you were to stop somebody on the street and ask them what the symptoms of a heart attack or stroke are, they could likely rattle many of them off. But if we ask what the signs of suicide or mental health crisis are, I bet most people would be challenged by that. Absolutely. So you guys are really working to create that awareness of what are those signs and symptoms. And are you going to be training other people in the city to understand what those signs and symptoms are?
So that is our goal, is to have myself and Lisa and Liana and Evanson will be working with the youth as well. And we are welcome to go into any agency that has a lot of people that could be suffering, because again, it's being on that front line, because early intervention is key. The earlier you can identify that somebody is struggling, the earlier you can provide them with services so they can get that treatment. You know, and it also, it has this message of hope. You know, a lot of the time somebody gets injured and they break their ankle and we're like, you're going to get better and it's going to be okay, and we're going to go to physical therapy and you're going to be great. And we want to, you know, use that same message for somebody who is struggling with a mental health crisis, that hope is, you know, there is hope, you will get better, there are things, people to help you, and it doesn't mean that there's anything wrong with you. You know, a lot of people suffer with mental health concerns, and doesn't mean that there's anything wrong. And as well, you know, Lisa and I, with the trainings that we do, are focusing on decreasing the stigma around substance misuse as well. So getting away from words such as addict and junkie, and saying person with a substance misuse challenge. Being able to raise awareness of that as well.
Because I think a lot of people don't realize that, you know, some of this is, you might be predisposed to heart disease or hypertension or those kind of things, but people are also predisposed to addiction and to substance use. You don't know if you're going to be that one that has a surgery or has an injury and is prescribed these painkillers and become addicted. It's not everybody, but there are some people that have that predisposition to that. So to reduce the stigma, it seems so important, because it can happen to anyone.
Absolutely. I always like to use a metaphor of, you know, at the end of a day, and you've worked all day, nobody wants to go home and cook a meal. Nobody wants to do the dishes. And so it's easier sometimes to go eat McDonald's. And you may not understand currently at that moment how eating McDonald's over a long course of time is going to be harmful for you. And it's the same way with substances, you know, starting maybe with vaping or cigarettes and then moving to cannabis and then moving to harder drugs. People don't realize that, you know, they want something to make you kind of feel better in the moment. And it's that long-term being able to cope with what you're going through. And the more services we have for people, the more they're going to have those things at their disposal instead of maybe some more unhealthy choices.
Right, right. So let's just step back, because you started to tell us a little bit about the mental first aid, and a lot of that relates to, and we know we have a big issue around suicide.
Yes.
And we're hearing a lot about it. We're hearing about it a lot around our youth. And you had written down a few things that in Dover, for example, that they had 3 students in 1 grade, and our sympathies really go deeply out to those families.
Absolutely.
What's going on, and what can we do? And what can we do as parents? Because I think a lot of our audience here are parents. What can we do to recognize the signs and symptoms? Is it okay to talk about it with our kids?
It's absolutely okay to talk about it. I think being able to bring awareness and, again, decrease that stigma and say a lot of people are, struggling right now. There's a lot of disconnection because of COVID, people needing to social distance, a lot of things being on the computer, so you're getting that computer fatigue. And I think that lack of connection, because that's really what drives people to feel a part of something. I think of Maslow's hierarchy of needs, where you have your physiological needs that you have at the bottom, but connection is absolutely one of those steps, and feeling as though you belong. So I think, for a year and a half, a lot of these students have lost some of that interconnectedness and feeling very isolated. And I think that has compounded maybe some underlying mental health issues that might have already been there. So for example, if somebody does have a chemical imbalance in their brain, and that would cause depression, any sort of loss or change is going to hit them harder. And again, if they don't have a parent at home that's recognizing that and offering them support, then they may not get that early intervention connection to those services to help them and to let them know it's okay. So if your child is struggling and you're seeing some of the warning signs, such as, obviously if a child comes home complaining about school, that wouldn't necessarily be
that would be a
sign.
typical sign in my house.
But it would be things that they typically enjoyed. So if they were a soccer player and then all of a sudden they, didn't want to be on the soccer team, or if they were in band and all of a sudden didn't feel band, then you might be like, I'm just wondering and making sure that you're okay. And, being able to replace those things, because again, activities, being involved, if you lose that aspect, you want to make sure that you're putting that back on. So being able to maybe suggest something else, and then again, talking about it. Are you feeling suicidal? Have you had any thoughts about harming yourself? Talking about it does not, this research has showed that talking about it does not increase somebody's likelihood to follow through.
Right, it's not the power of suggestion.
Correct.
It's okay to talk about it. And I think that's a really interesting point, that you can talk to your kids about it. And especially if you are suspecting that they're in a dark place.
And I think for children, there's this worry that you're putting things on your parent. Like, I don't want to tell my parent that I'm upset because then I'm putting blame on them, or they're going to feel responsible. And I don't want to put my feelings onto them, that projection. So kids may feel as though they can't go to their parents for what's going on, or they may not understand. There's a generation disconnect, And so I think by parents may be the ones to have to open that dialogue, and because the youth may not do that.
Right, and we've already put a lot of responsibility on our teachers.
Yes.
So when the teachers are reaching out to the parents and vice versa, we really have to work as a team to reach the kids and make sure that they don't, do anything that would break all of our hearts.
Because again, they're looking, sometimes those negative feelings just get so compounded that you feel like you can't keep going. It's just such a weight to weigh kids down. And if they don't feel like things are going to get better, and, seeing COVID and it continuing, and then kids may feel like it's not going to end. And that hopelessness that really drives depression, that hopelessness and powerlessness, and things won't get better.
Yeah, so something else that I think you talked about was the National Random Acts of Kindness Day.
Yes.
Was that and then you guys are doing a postcard campaign, and we have a picture of the postcard we could pop up on the screen. And I'm looking to peek at it, but I don't have it in my pile. But when we talk about this postcard, and it's really anyone can reach out to somebody else and let them know that they matter. It's that communication. So just tell us a little bit more about that, and if people want to get some cards.
Absolutely. Well, that connection and that really is what drives people to feel as though they're a part of something. And so Lisa and I were talking and thinking about who right now would be struggling the most with connection. And that might be people who are living in nursing homes, assisted living facilities. The COVID restrictions may have people unable to visit and being worried about being able to transmit to people who are vulnerable, because obviously the people that are living in nursing homes are vulnerable. And so they may not be having the connection that they were having prior. So we thought of a way, how can we do that? It's Valentine's Day. We want to share some messages of love and hope. So we have some postcards that we are working with some of the youth serving agencies. We've gotten some collaboration with the Boys and Girls Club, Police Athletic League, and the 21st Century programs. We're going to distribute the postcards to the youth and then have the youth write some messages of hope and positivity. And then we're going to distribute them to some of the nursing homes in the region. And being able to, again, identify that those are some people who might be living in a situation where they're not feeling a lot of connection. And just to let them know that somebody out there cares about them. And it's really good for the youth to do that as well. One of the things that really helps mental health is feeling as though you're doing things for others and being able to teach that foundation, because then they feel good. And then we can say, this is where your postcards went and you made somebody feel cared about and cared for. And that's what we're all looking for.
Right, we definitely are. It says, be the reason someone smiles today.
Absolutely.
So that's just like a really positive.
And anybody, it doesn't have to be a youth serving agency to get involved in that program. If anybody is interested in participating in that program and would like to come and get some postcards and fill them out, can come down, call the Division of Public Health and Community Services, and you can ask for a member of the behavioral health team, and they'll be able to help you.
Great. Well, thank you. And just one last thing we were talking about today, and you had mentioned like mental health and the weather.
Yes.
We're going to have a big storm. So we're all going to be shut in again. But what are some of the things you can do to just maintain your sanity, so to speak, and your clear-headedness during these times?
Absolutely.
I think winter.
Reading a book, if you're interested in art, if you're a knitter. I know my coworker Lisa, she knits, and that's something that she really enjoys. So something to keep yourself busy. I find that it's when you're not busy that minds start to wander and thoughts start to be had, and that can lead somebody into a kind of a depressive mood. And so you want to do things to keep yourself keep that dopamine going in your head and the serotonin going in your head. So maybe call somebody on Zoom if we have electricity. Being able to pick up a phone and call somebody that you haven't called in a long time. There's helplines as well. We're looking to get the 988 number going soon. I think that's going to be in June, but there are other hotlines that people can call if they don't have anybody to call that they can connect with as well.
So tell me about the 988 number, because I know that is coming. I think it was supposed to come earlier, but there's some technical issues. Can you just explain what that is and why the importance of that number?
Absolutely. So similar to 211 here in New Hampshire, where you can call 211 and have access to social service agencies to be able to help you. This is going to, my understanding is it's national. So everywhere will have 988, all the states in the country, and it will automatically connect you to a suicide hotline where you can talk to somebody if you're struggling with a mental health challenge. And just being aware that mental health does not discriminate. It goes against all socioeconomic, gender, race, ethnicity lines. And so anybody is susceptible to have a mental health challenge, and just being aware of that. So especially, again, with the weather, being isolated, feeling maybe even helpless. If you have an older person that isn't as strong and can't go out and shovel, and that need even sometimes to have somebody come and help for an older person can trigger a little bit of depression. It's that feeling of, not being able to do, I think.
Right. Well, thank you, Leah, so much for talking to us. There's so many programs and so many things that you guys are doing in the community, so many important things, and I'm sure as you continue to settle into the division and all the needs in the community, you're going to realize there's even more to do, but which is why we have you.
Well, it's exciting. I feel like I've been involved in a lot of different systems. I worked for DCYR for a little while. I've been in the schools. I've been at a youth serving agency. So being able to take that information and kind of apply it in a more systemic, broad fashion. So I know we're working on the CHIP, which is the Community Health Improvement Plan.
Oh,
and I look at that as it's like a treatment plan for the city. Instead of, individualized therapy where you'd be working on a treatment plan for a person, we're working on a treatment plan for the city. Being able to recognize any barriers to organizations that could help somebody, what things are out there. So Lisa and I and Liana, part of our behavioral health division, are going to be holding a behavioral health symposium, kind of like a conference at some point. And our hope is to be able to have any behavioral health, substance misuse therapy agency come so that people can see what services are available.
And
at the
that's
same
so
time,
important because
absolutely.
not every agency can do it all. And that community collaboration is exactly what we're trying to promote when we have a community health improvement plan. And your section, so to speak, your section, I mean, all the sections are everybody's sections, but you know, when we went back and we looked at our community health assessment, and we prioritized these areas and went and surveyed the community and the workers in the community that are working in mental health and behavioral health. You know, mental health came up during chronic disease, came up during communicable disease. It really came up like everywhere. But in your specific, in the behavioral health section of our community health improvement plan, we're really looking at substance use, overarching, decreasing substance use. Correct me if I'm wrong, because I've been looking at all these things all the time. So we have that. We have suicide. And when we talk about substance use, it's it's alcohol, it's illicit substances, it's tobacco and vaping, and marijuana. So it's a big group. And we also talk about workforce and what can we do as an organization? How can we advocate to make it easier for people to become therapists, to work in the field, to be compensated fairly, so that we can help people. So there's a lot in that, there's a lot in that priority area. But I'm really looking forward to working on all of that with you and Lisa and Liana and the community.
Absolutely. The workforce is definitely a need. I hear a lot about wait lists, and a lot of people I feel like are accessing the hospitals when they have a mental health crisis as well, and that can overflood the hospital resources, especially during this time with COVID. So having a mental health fair so people can see what's out there, similar to a job fair, similar to a college fair, you know, being able, and it helps us all to see, wow, look at all these great people that are out there helping, and it helps us to motivate, I think, for the cause on that systemic level again as well. So.
Yeah, so that's great. Well, thank you so much.
Thank you.
We hope you'll come back.
Absolutely.
Maybe come back with Lisa and Liana as well. I just want to remind our viewers that the Vaccine Fix site is now open. It is on 34 Northwest Boulevard, actually off of Amherst Street in the Market Basket Plaza. So please, you do not need an appointment. And it is open every day from 8 a.m. to 2 p.m. And also a reminder that there is free COVID testing available at 25 Crown Street in Nashua. And I would also like to put in a plug for our health clinic. We are open Tuesdays, Wednesdays, Thursdays, and Fridays, different hours. You'll see them up there on your screen. We do immunizations at each of these clinics, childhood immunizations, as well, of course, the COVID vaccine. Please call ahead for an appointment, 589-4500. Press option 2. We also do lead screening and STD testing. And finally, folks, be part of the solution out there. Get vaccinated, wear your masks, social distance, and wash those hands. And have a safe and healthy week ahead. And we'll see you next time.